Good day and welcome back to HelpMeWithMyTeeth.com. I'm Dr. Martin Potter, your host. Today we're going to hit again this whole idea of dental treatment amidst this COVID pandemic. Boy, this thing just keeps dragging on. We just keep having to come back to this. It's like it just doesn't want to go away in our lives. We're all struggling to get back to some sort of sense of normalcy, but this thing keeps hanging around like a bad smell. Let's get this article going and have a look at this one. Okay, here we go. Should we be delaying routine dental checkups at this time of the pandemic? The WHO are coming out a little bit in favor of just kind of delaying this thing and slowing things down in terms of getting your dental treatment. So here we got an interesting article from just a little under a week ago from Geneva, Switzerland, and the Jakarta Post. So let's get into this one and see what this one has to say. Dental patients and staff need to be protected from any potential infection by aerosol generating procedures. Okay, there's the big buzzword that we're all hearing right now, these AGPs. So the idea here is that a lot of dental work, certainly the high-speed handpiece, but also cavitrons, which are the ultrasonic cleaning devices that the hygienists use, and the air water syringe can generate aerosols, so tiny little droplets of water that are suspended in the air. And the question is can the coronavirus, the COVID-19 virus particle, end up suspended on those water droplets? And yeah, here we go. Floating particles that may cause an infection if inhaled. These include the three-way air water spray, ultrasonic cleaning equipment, that's your cavitron I was telling you about, the hygienist uses, removes deposits from the tooth surface of polishing, the WHO said in a new guidance. So again, it's a little controversial. There currently is no data on these things, so we really don't have a definitive sort of situation saying, you know, what's really going on with these things. Are these aerosol generating procedures really a risk or not? WHO guidance recommends in case of community transmission to give priority to urgent or emergency oral cases to avoid or minimize procedures that may generate aerosol. Prioritize a set of clinical interventions that are performed using an instrument, and of course to delay routine non-essential oral health care. So, you know, any sort of, you know, cosmetic procedure, perhaps a crown, perhaps, you know, an elective root canal, maybe even wisdom teeth. That's the sort of procedures that we're talking about. Should they be delayed? You know, this stretches out all across the whole medical world, you know, not just dentistry. You know, people are delaying getting their cancer treatment done. They're delaying kidney treatment, transplants. All sorts of issues are sort of hanging in the balance right now. But, you know, in terms of dental, definitely don't be discouraged to get your essential treatment done. If you have a cavity, if you have a toothache, if you have a growing problem of pain and you're suffering, please do not suffer. Please come, you know, see us at the office. Let us get you fixed up, because it's just going to get more expensive and you're going to get yourself in more trouble and suffer longer, and it's going to be harder to get you all fixed up. What we're talking here more is these situations of elective or routine non-essential. You know, that's more what we're kind of zooming in here on this article. These ones maybe are a little bit more controversial. We could, you know, take either side, but, you know, I've definitely been doing some wisdom teeth. I've been doing some crown and bridge. So, you know, there's lots of people that are, you know, happy to move forward. Yeah, the likelihood of COVID-19 being transmitted through aerosol microparticles or airborne particles today, I think, is unknown. My personal feeling is that I think the risk is quite low. I think we'd know by now if there was a high risk of this. We'd be seeing some spread, and so we'd have some data on this by now. Now, of course, I'm preempting that. There some research may come out to show the contrary opinion, but right now it is questionable, it is unknown, but there's a lot of dental work that's being done now. We're really not getting a whole lot of information about things going wrong. The WHO last month released general guidelines on the transmission of the coronavirus, which acknowledged some reports of airborne transmission, but stopped short of confirming that the virus spreads through the air. You know, it's hard because we heard so much about this at the beginning, about this, you know, these air droplets, and then now, of course, with the masking, you know, we're seeing a lot more about you know, this trying to stop these aerosols and trying to stop the transmission through aerosols. Down the road, we're going to do something more about mask and mask mouth. We're seeing something that's popping up now in the dental literature about anaerobic bacteria growth increasing from people wearing a mask too much. Just stay tuned. We're going to get to that one and get into that in the future. Dental facilities must have adequate ventilation to reduce the risk of the virus. Yes, and we are having air exchangers that are rapidly changing over the air quality with HEPA filters in the operatories very quickly. So we're all doing that more and more. So that's definitely helping out. We think the most pressing issue is related to the availability of essential personal protective equipment, or PPEs, for all healthcare personnel undertaking or assisting in the clinical procedures. Definitely we need to get into PPE, but please don't get too nervous about getting your dental work done. I'm confident that we can deliver quality care for you in a safe environment so that you're not going to get sick. Of course, if you're an at-risk person, if you have comorbidities, you know, if you are aged, if you live in a long-term care home, that's definitely a bit more of a different situation. But, you know, for those of you who are young, who are healthy, you know, who don't have any other, you know, concerns in terms of other ancillary healthcare complications, please go to your dentist. Please get fixed up, and don't get yourself too concerned about that. Okay. Hope that helps you get a little handle on the COVID-19 pandemic. Okay, so there we are, dental routine checkups amidst COVID-19. I mean, I can't help but just sort of advise you to just move forward with your dental care. From my standpoint, you got pretty much a green light to go ahead with your dental work, but let's just keep our ear to the ground and make sure that we're all going to stay safe. So go ahead and leave us a comment below, hit that like button, feel free to subscribe, and good to see you again. We'll see you next time on HelpMeWithMyTeeth.com. Have a great day.